1, this is Jane, your instructor for vital signs measurement. The very first thing to do is measuring your patient's vital signs is to wash your hands with soap and water. Or you may sanitize your hands using 70% isopropyl alcohol. Next is to bring the thermometer tray to your patient's bedside or room. Then you have to introduce yourself to your patient and explain the procedure. Hi, Mrs. Porto. I am Jane, the caregiver assigned to you this morning. And I am here because I would like to check on your vital signs. That is, I am going to check your temperature, your pulse, respiratory rate, and blood pressure. Is it okay for you? But before anything else, I would like to check whether you have rested for at least 5 to 15 minutes. Okay, so I can proceed now with the procedure. First, I will check the temperature of my patient using a digital thermometer. So this is an example of a digital thermometer. I will disinfect this using cotton ball wet with 70% isopropyl alcohol. Starting from the tip of the thermometer and using a firm circular motion, clean the thermometer going to the stem. Dispose of the dirty cotton ball inside the base. And then dry the thermometer, starting again from the tip of the thermometer going to its stem. And dispose of the thermometer. Next, I will ask my patient to raise her arm so that I can place the thermometer on her underarm. How important can you raise your arm? I will be placing the thermometer under your arm, and you have to keep still until this thermometer beeps. Turn on the thermometer and place it. Make sure that you can see this figure. Next, I will be checking my patient's pulse rate. So to do this, you have to place the arm of your patient on her chest, and the hand or the palm of your patient must be facing downward. Using 2 to 3 middle your index and your middle fingertip, locate your patient's radial pulse. Okay. So I can now palpate my patient's radial pulse, and using a watch with a second hand, you have to count the number of pulsations for 1 full minute. Fifty-five, 10 counting the number of pulsations for 1 full minute, you have to leave your fingertips over your patient's radial pulse and start counting for the number of respirations for 1 full minute. To count for the number of respirations, you have to count the number of cycles by counting or by observing the rising and the fall of your patient's chest. You have to count 1 once your patient's chest falls. Three, 4, 5, 6, 'So supposing it's already 1 full minute, make sure that you have counted the number of cycles in 1 minute. Just make sure that you have counted 1 cycle once your patient's chest falls down. Okay, that's 1, and then 2, and then 3. So after counting the number of cycles per minute for the respiration, you have to immediately record it. So using your notebook and your pen, you have to record the pulse rate. Pulse rate is 80 beats per minute, while respiratory rate is 20 cycles per minute. Alright. At this time, I will now get the thermometer from the patient's underarm. In this torso, I will just get the thermometer. Thank you. Before reading the value, you have to dry the thermometer first. So at this moment, the dirtiest part is the tip. So you have to dry starting from the stem, going to the tip. And then the last is get a cotton ball with 70% isopropyl alcohol and disinfect the thermometer. After reading the thermometer. 36 points. And return the thermometer to its place. Record the temperature. It's 36.2 degrees Celsius. Degrees Celsius. Moving forward, so at this moment, I will be checking your blood pressure so that we will know whether your blood pressure is normal or you're having hypertension. For checking the blood pressure, we will be needing a BP apparatus, your aneroid manometer, and a stethoscope. You'll have to position your patient's arm in the anatomical position with the palm facing upward. Next, roll the patient's gown sleeve up. Provide ample space for the BP cup. Okay, this is what we call a BP cup. This is the bladder. We have the artery indicator label here for the left arm and for the right arm. And when placing the BP cup, you'll have to place it at least 1 inch above the anti-cubital fossa. So this is the anti-cubital fossa. We will be placing this 1 inch above and considering also the artery indicator label for the left arm. So wrap this around your patient's arm. Not too tight and not too loose. You must be able to insert at least 2 fingers. Make sure that the Velcro stays okay. This is what we call the manometer. Place this in the gauge holder. This is what we call a gauge holder. Aneroid manometer reads 0. Okay, next, locate your patient's brachial pulse. So the name is brachial pulse. You're using your index and middle finger and ring finger to locate for the brachial pulse. If you have located the brachial pulse, get a stethoscope. Place the earpiece to your ear, but you have to adjust it. The earpiece must be facing away from you. It must be facing away from you. And then place it into your ear. Then check the stethoscope if it is functioning. Okay. If this is the case, the diaphragm is closed. And you will not be able to hear anything, or you can hear a very soft sound. So you have to rotate to close this and to open this. Next, place the diaphragm of the stethoscope over the brachial pulse. And support it with your index and middle finger, not your thumb. Not your thumb. Or else you're going to hear only pulse. So only the middle and index finger. Next, you hold the bulb, inflation bulb, and close the thumb screw. Thumb screw. Close. Okay. In checking the blood pressure, we have to first look or listen for the point of obliteration. And the point of obliteration is where the pulsation stops. So right after the pulsation stops, or at the point of obliteration, you have to add at least 20 to 30 millimeters of mercury. And after that, you have to release the pressure and listen for the first and last sound. Okay, I will now inflate. So as you can see, there is a rise in the blood pressure. At 100, I can still hear my patient's pulse. Okay. At 110 millimeters of mercury, I can no longer hear the pulsation. So this is what we call the point of obliteration. I will add at least 30 millimeters of mercury. 10, 20, 30. So that's 140. So I will now release the pressure and listen for the first sound and last sound. The first sound is the systolic BP and the last sound is diastolic BP. Release carefully at least 2 to 3 millimeters per second. release until 0. The first sound was heard at 110, and the last sound is at 80 millimeters of mercury. Remove the stethoscope and the gauge and the BB cup. Return the BB cup with tape completely. And roll down the sleeve. And record the blood pressure. Blood pressure of our patient is 110/80 millimeters of mercury, or mmHg. Okay. Then tell the patient the significance of your reading. Comfortable. Your vital signs are all normal and there is nothing to worry about. Your blood pressure is also normal. Thank you very much for your cooperation. And lastly, you have to wash your hands. Make your patient comfortable before leaving the room. Thank you.